Welcome. My name is Heather Hancock, and I'm going to be walking you through a set of advocacy packages that the Breakthrough Action Project developed to help encourage investment in and support for social and behavior change in family planning and reproductive health. And you can access these packages via the QR code here on the screen. We know that SBC is a proven and cost-effective approach. It can really help us to achieve our global family planning and reproductive health goals, such as ensuring universal access to FPRH information and services. And research has really shown that SBC can increase successful outcomes in family planning, that it can complement service delivery investments, and also has a very high return on investment in both the short and long term. However, what we find is that SBC is often misunderstood, deprioritized, or narrowly implemented in various contexts. And we also find that decision makers face real challenges when it comes to supporting and investing in SBC for FP and RH. One of the objectives of the Breakthrough Action Project is to advocate for increased investment and support for SBC, particularly in FPRH. And so to understand better what influences the investment behavior of key decision makers, Breakthrough Action conducted a behavioral analysis. And this analysis identified key barriers and needs and other insights related to investing in SBC for family planning and reproductive health. And then Breakthrough Action compiled these into an insight brief, which includes opportunities for addressing these findings. In response to the needs and the barriers identified through that behavioral analysis, Breakthrough Action created a collection of resources that is tailored to each one of the groups that was included in that behavioral analysis. And there are 3 total packages, one for donors, one for country decision makers, and one for service delivery implementing partners. And these advocacy packages consist of a resource collection and a guide for those audiences. The advocacy packages are designed to help each of the stakeholder groups that I just mentioned overcome the challenges that they face in supporting or investing in SBC for FPRH. And as I mentioned, there are 2 different parts of it. There's the collection of resources, which can be found on FP Insight website. And then there are also resource guides. And these resource guides present the challenges that that particular audience faces, the opportunities that could be used to address those or meet those challenges, and then a set of tailored resources for each of those opportunities. And I'm going to be walking through each of these packages and showing you what they contain. So to help you understand these packages, I will be providing a high-level overview of each package, the resources that are included, and a scenario for how one of those resources from the packages might be used in a context like yours. So let's start with the donor guide. The donor guide in total, or the resource collection package, has 23 resources. And the structure is, as you can see on this screen here, there are 3 challenges, key challenges that the donor group faces. And each of those challenges is divided into opportunities. You can see that challenge 1 here has 2 different opportunities, and then each of those opportunities has a set of resources associated with it. The second challenge also has 2 different opportunities listed with resources tailored for each of those opportunities. And then the third challenge has 1 opportunity and a set of resources associated. So to give you a sense of what these challenges and opportunities are, I will walk through each one of them. The first challenge that we found donors really face is that donor investments in family planning and reproductive health programs have to align with national strategies, but oftentimes SBC is not included explicitly in those national strategies. And if it is, it's often narrowly defined. And so it's difficult for donors to align with those and still include SBC in their investments. So we have 2 opportunities that could potentially address that challenge. The first one is that donors could learn more about how increased investment in SBC for FPRH can effectively strengthen the health system and the existing service delivery investments by more effectively engaging communities and building trust in the health system. And there is a set of resources here on the right associated with that opportunity, including the Circle of Care model, the Think Big resources, an article about the 6 domains of behavior change and the missing health system building block, and then also a brief on social and behavior change and health system strengthening, and similarly, the brief that talks about how to increase the use of SBC and health system strengthening programming. The second opportunity is to work with country-level decision makers and implementing partners to make sure that SBC is included in national FPRH strategies as an essential component. And there are a few resources listed here that could also be used to address that opportunity. One is elevating SBC as an essential component of family planning programs. Another is an SBC checklist and guide to develop and assess costed implementation plans. And then finally, using SBC to increase family planning uptake in Zambia, making the case brief. The second challenge that donors face is that the programs really do need to show a direct link to outcome indicators, but oftentimes it can be really difficult to measure and quickly observe the direct impact of SBC on things like contraceptive uptake. And so a couple of opportunities that could present themselves here is that donors can review and familiarize themselves with the evidence base and examples of impactful SBC for FPRH interventions so that that could inform future investment designs. Some resources that could be used here include the Family Planning Evidence Database briefs, which talk about the evidence for various SBC for FP interventions. Also, the Using SBC to Improve Family Planning Outcomes brief. And then similarly, the French version of that document. And then finally, the evidence database itself that has a number of resources and articles that can be referenced to show the impact of SBC. The second opportunity is to require standard SBC indicators for FPRH in donor investments. And there are a few resources that can be used here, including the 12 recommended SBC indicators for FP and also the reference sheets. And then also considerations and guidance for using routine and program monitoring data for social and behavior change evaluation. And the French version of that is also included. The third and final challenge for the donor group is that investments need to show value for their money and rapid success, but a lot of times people assume that SBC is expensive or they're not familiar with SBC's return on investment. And so the opportunity here is to learn more about SBC's return on investment and some examples of what the return of investment looks like when comparing different SBC approaches. There are a number of resources here that can be referenced, including the business case for investing in SBC for family planning, an interactive tool that can accompany that business case model. Investing in social and behavior change is cost-effective blog post. There's also an Exploring Pathways to Social and Behavior Change Impact website, and examples from various countries, including Guinea, Niger, Zambia, and Togo. So let's look at just a quick use case of how some of these resources might be used. Let's say that there's a scenario where a donor in a specific country is not convinced that SBC will yield a high return on investment and contribute to their overall family planning goals. One resource that you could potentially use is the business case for investing in SBC for FP. And you could use that resource, for example, to look at the relationship, help donors see the relationship between various SBC intervention types like mass media or IPC or various packages, and show how those can improve attitudes, for example, the approval of family planning or communication with a partner and other people. So you can really show the impact that various interventions can have on family planning goals. You could also walk through the business case to look at how much each of these intervention types might cost so that they have a better sense of what the return on investment might be. In addition, you could walk through one of the case examples included in the business case document, for example, the SBC programming in Egypt example, so that they have a better sense of what it looks like and what the return on investment was for another country or case. And finally, you could also use the interactive tool for the business case and model what it might look like for a particular country and what outcomes you might expect based on different kinds of SBC interventions. Let's now move on to the country level decision makers guide. Similarly, this resource package has 23 resources included in it, and the structure is the same generally as the donor guide. There are 4 challenges that were identified for the country level decision makers. And then each of those challenges, for example, challenge 1 has 1 opportunity associated and some resources. Challenge 2 also has 1 opportunity, as does challenge 3. And then challenge 4 has 2 different opportunities and some resources associated. So again, let's look through what these might look like. The first challenge that we found when we were doing the behavioral analysis was that national family planning and reproductive health plans and strategies are often written according to the health system building blocks, and those building blocks do not explicitly include SBC. And so it's really difficult to think through how and where SBC might fit within that model. So one opportunity that we identified was to learn more about how investment in SBC for family planning and reproductive health can effectively strengthen the health system and other service delivery activities and programs that currently are ongoing, and really think through how to engage communities better, build trust in the health system, etc. And the resources here are similar to what you found in the donor guide, which include the Circle of Care model, the opinion piece on elevating social and behavior change as an essential component of FP programs, the Health System Strengthening Evidence Gap Map, the 6 domains of behavior change, the Missing Health Building Block article, the Social and Behavior Change Health System Strengthening White Paper, and increasing the use of social and behavior change in HSS brief. The second challenge is that the costed implementation plan process is very overwhelming and burdensome to the partners, and so it's difficult to add one more thing or think through how SBC could be used or budgeted for. And so the opportunity here is to learn more about how to effectively plan for and incorporate SBC in those costed implementation plans, including how to budget for it and how to include it in the other national strategies. And there are several resources that could be used here, including the SBC checklist to develop and assess costed implementation plans for demand creation, as well as the user guide that goes along with it. There's also guidelines for costing of SBC interventions document, as well as a costing tool, and then a blog post about understanding costing. The third challenge is that government partners often find certain audiences hard to reach, and that those audiences may mistrust services due to historical discrimination or other problems. And so government partners often are not sure how to reach those audiences. And so they could use some of the resources in this package to learn how tailored investments in SBC for FPRH can enhance the effectiveness of other program approaches and reach specific audiences. Some of the resources here are some various briefs on how to prioritize and target investments to address adolescent pregnancy, for example, a brief about first-time parents and young married couples, how to use SBC to enhance programs to end child early and forced marriage, and then also prioritizing and targeting SBC investments for married youth. The final challenge here is that investments need to be linked directly to the uptake of family planning, and results need to be quick. And so sometimes that has been a challenge with SBC and seeing how they contribute to those specific results. So the opportunities here are to review the evidence base and examples of impactful SBC to understand better how SBC could help countries reach those goals within the resources that they have. And again, they can use the family planning evidence database to look at different articles and the impact, as well as the briefs that come from that evidence database. They could also review the Using SBC to Improve Family Planning Outcomes brief, as well as the French version of that. The second opportunity is to incorporate standard SBC indicators into the National Health Management Information Systems like DHIS2 or other monitoring platforms. And again, there are similar resources included from the donor package, those 12 recommended indicators and the indicator reference sheets and the French versions of those, and then also the considerations and guidance for using routine and program monitoring data for SBC evaluation. So one example here for a use case is that let's say that government partners are open to including SBC in the costed implementation plans, but they don't quite know how to develop an SBC plan or budget for it appropriately. There are a couple of resources that you may potentially use with the government partners in this case. And the one is the SBC checklist that would help them to plan for and prepare an SBC CIP. And then the second resource is the guidelines for costing SBC interventions. So you could use, for example, the SBC checklist to really think through what needs to happen and what would need to be included to create an SBC sort of plan for the costed implementation plan. You could also use the guidelines document to really think through where you would collect the data and understand how much each unit might cost in a particular country. And then you could also look through the guidelines document to see some of the SBC costing case examples, which are really practical and would help the government partners to think through what that might look like in their particular country or case. Finally, we have the guide for service delivery implementing partners. And this resource collection and guide present 4 different challenges that service delivery partners face. And there are 30 resources included in this particular package. Challenge 1 has 2 opportunities. Challenge 2 also has 2 opportunities. And then challenge 3 and 4 have 1 opportunity each and their associated resources. The first challenge that service delivery partners face is that partners really need to show quick results and they have limited resources and they have to link those to concrete outcomes that are based on their mandates. So the opportunities that we saw here are that service delivery partners can review and familiarize themselves with the evidence base and examples of impactful SBC. And the resources that they can use to do that are the Behavior Change Impact Family Planning Evidence Database, the Social and Behavior Change Indicator Bank for Family Planning and Service Delivery. And then there are several different briefs, including the Circle of Care Evidence briefs that show how using SBC along the circle of care before, during, and after services can help to improve outcomes. There's also the Demand, Comfort, and Continuity, Aligning Service Delivery and SBC Efforts brief. There's the Promoting Healthy Couples Communication HIP brief, and the Mass Media HIP brief, and the Knowledge, Beliefs, and Self-Efficacy HIP brief. The second opportunity is to learn more about budgeting for and costing SBC interventions. So you'll see some similarities from the last guide of those guidelines for costing SBC interventions, and also creating a social and behavior change cost repository and costing tool, and then the Understanding Costing blog post. The second challenge is that partners may not know where SBC fits in their service delivery programs, or they might not have staff that have adequate SBC technical expertise. The first opportunity is that they can learn how SBC can be used at each stage of the service continuum, so before, during, and after receiving services, and how it complements other health system strengthening approaches. For this, they could use the Strengthening SBC for Service Delivery Tailoring Interventions brief, or also the Elevating SBC as an Essential Component of FP Programs opinion piece, the Circle of Care model, or also the Increasing the Use of SBC in Health System Strengthening brief. The second opportunity is to learn how to apply SBC approaches and techniques to service delivery efforts. And they could do this by reviewing the Vision to Action guidance document on how to implement the Circle of Care model, using the Provider Behavior Change Toolkit for family planning, reviewing the article on 6 recommendations for provider behavior change in family planning, or also taking the SBC for Service Delivery e-course. The third challenge is that partners are affected by increasing levels of inequity in the context in which they operate. So it's really difficult to address the inequities in the programs that they're facing. One opportunity here is to learn how to support an enabling environment that addresses some of those harmful social norms and structural inequities that impact ultimately those FPRH access and outcomes. There are a few different resources here, including the Expanding an S in SBC and Addressing the Social Determinants of Health and Health Equity in SBC Programming brief. The brief also on incorporating the social determinants of health into SBC programming for family planning, the Road to Equity in Family Planning document, the website on using a multimedia strategy, which shares some examples on how equity has been addressed, particularly social norms, and then the Social Norms Promoting Community Support for Family Planning brief, and the Implementing and Innovating Upon Best Practices for FPRH Results. And some of those are the experiences from the West Africa Breakthrough Action Program. Finally, the last challenge that service delivery partners face is that partners are tied to specific activities and expected outcomes that are often aligned with the national family planning and reproductive health plans and strategies, which, as we've covered before, do not typically include SBC. So one opportunity here is to work with the country level decision makers and donors to ensure that SBC is included in those national family planning and reproductive health strategies and plans as an essential component of those programs. And one of the things that could be resources that could be used here is the Social and Behavior Change for Family Planning User Journey Tool, or the Social and Behavior Change for Service Delivery Community of Practice Shared Agenda, which could help align on some of those shared priorities. The user guide for the SBC checklist document for costed implementation plans, and also the actual checklist itself. And then the Advocating for Social and Behavior Change in Family Planning Programs message framework. To finish off, let's look at a final use case for service delivery partners. Let's say that a service delivery partner is not feeling very confident in applying SBC to their programming, whether that's they don't know exactly where it fits or they just feel like they don't have the skill set. One resource that you could use with those service delivery partners is the SBC for Sexual and Reproductive Health Service Delivery e-course. And you could use that e-course to help lay the foundation and help them understand what SBC is when it comes to service delivery programming, the different approaches that they might use. You could help them understand how various factors influence service-related behaviors, and also understand provider behavior change and the factors that may be affecting providers, which ultimately lead to and affect the outcomes that you're seeing as service delivery partners. So thank you so much for walking through this with me. If you have any questions, you are welcome to reach out to me. My email is listed here on the screen. And we hope that these advocacy packages are very helpful for you in addressing the specific needs, barriers, and issues that key decision makers face when investing in or supporting SBC for FPRH. Thank you.